Ever walked into a hospital and been overwhelmed by the symphony of beeps, dings, and alarms? It's a constant, almost chaotic soundscape. Now imagine working in that environment for 12 hours straight, day after day. That's the reality for nurses. And that constant noise is more than just an annoyance. It's a serious health hazard. Today, we're diving into the hidden crisis of alarm fatigue and exploring how the very sounds designed to save lives are making nurses sick. It's a story of sensory overload, chronic stress, and a healthcare system on the brink of a burnout epidemic. Let's start by understanding what we're talking about. In a typical hospital setting, a single patient can be connected to multiple monitors, each with its own set of alarms. You have the heart monitor, the blood pressure cuff, the pulse oximeter, the IV pump, the ventilator. The list goes on. Now multiply that by the number of patients a nurse is responsible for. Studies have shown that a single ICU bed can generate hundreds of alarms per day. Some estimates suggest a nurse might hear up to 1,000 alarms in a single shift. That's more than one alarm every minute. The problem is, the vast majority of these alarms, somewhere between 85 to 99%, are not clinically significant. They're false alarms or technical alerts. Maybe a sensor just needs to be repositioned, or a patient shifted in their bed. This creates a classic boy who cried wolf scenario. When you're constantly bombarded with non-urgent alerts, your brain starts to tune them out. This is a survival mechanism known as alarm fatigue. It's not that nurses don't care, it's that their cognitive capacity is completely overwhelmed. They become desensitized to the noise. And this is where it gets dangerous. When a real critical alarm sounds, the one signaling a life-threatening event, it can get lost in the noise. It might be ignored for a few crucial seconds, or the response might be delayed. These delays can have catastrophic consequences for patients. The Joint Commission, a major healthcare accreditation organization, has identified alarm fatigue as a national patient safety goal for years, citing numerous sentinel events. That's industry talk for unexpected occurrences involving death or serious injury, linked directly to this issue. It's a paradox. The systems designed to enhance safety are, in their current state, creating a new and profound risk. But the danger isn't just to patients. Let's talk about what this constant auditory assault does to the nurses themselves. Our bodies are hardwired to react to alarm sounds. Think about a fire alarm or a car horn. These noises trigger our fight-or-flight response. Your heart rate increases, your blood pressure goes up, and your body is flooded with stress hormones like adrenaline and cortisol. This is a fantastic system for escaping immediate danger, like running from a predator. But it was never meant to be activated hundreds of times a day, every day. For nurses, every beep and ding is a potential microdose of stress. This sustained activation of the stress response system leads to a state of chronic hypervigilance. They are always on edge, always waiting for the next alert. Over time, this takes a massive toll on their physical and mental health. The constant elevation of cortisol, the primary stress hormone, is particularly damaging. Chronically high cortisol levels are linked to a terrifying list of health problems: high blood pressure, heart disease, weight gain, impaired immune function, anxiety, depression, and even cognitive decline. We're essentially asking nurses to work in an environment that is systematically poisoning them with stress. This isn't just a feeling of being stressed out. This is a physiological process with real-world health consequences. It's sensory overload on an industrial scale. Imagine trying to focus on a complex task, like calculating a critical drug dosage, while a dozen different alarms are blaring in your ears. It's incredibly difficult. This constant distraction increases the risk of medical errors, adding another layer of psychological pressure onto an already overburdened workforce. It contributes to burnout, compassion fatigue, and a feeling of being constantly overwhelmed. Many nurses report experiencing phantom alarms, hearing the beeps and dings even when they're at home, trying to rest. They describe having trouble sleeping, suffering from headaches, and feeling a persistent sense of anxiety that they can't shake. This isn't just part of the job, it's a symptom of a deeply flawed system. We're losing experienced, compassionate nurses from the profession, not because they can't handle the work, but because the work environment is making them physically and mentally ill. The high turnover rates in nursing aren't just a staffing problem. They are a direct consequence of these unsustainable working conditions. So what's the solution? This is a complex problem, and there's no single magic bullet. But innovative hospitals and researchers are exploring promising strategies. One of the most effective approaches is alarm customization. Instead of having every monitor set to a loud, one-size-fits-all default, the parameters can be tailored to individual patients. For a stable patient, the alarm thresholds for heart rate or blood pressure can be widened, reducing the number of false alarms without compromising safety. Another key area is smarter technology. Engineers are developing smart alarm systems that use algorithms and artificial intelligence to filter out the noise. These systems can integrate data from multiple monitors to identify truly critical patterns, only alerting the nurse when a genuine intervention is needed. For example, instead of a simple alarm for a low heart rate, the system might check if the patient's blood pressure and oxygen levels are also dropping, indicating a more serious event. Some systems can even escalate alerts, using different sounds or routing the alarm directly to a specific nurse's personal device, bypassing the noisy overhead system for non-critical issues. Changing hospital policies and culture is also crucial. This includes implementing alarm-free quiet times, especially at night, to allow patients and staff to rest. It also means providing better and more frequent training for nurses on how to properly manage and interpret alarm settings. Empowering nurses to adjust parameters within safe, pre-approved limits gives them more control over their auditory environment. We also need to reconsider the very design of hospital units, incorporating better acoustics and layouts that can help dampen the spread of noise. And finally, we need to address the human factor. We must support the nurses who are already suffering. This means providing accessible mental health resources, creating a culture where it's okay to talk about stress and burnout, and ensuring adequate staffing levels so that no single nurse is responsible for an impossible number of alarms. If a nurse is struggling, it's vital they know that help is available and that seeking it is a sign of strength. We've included links in the description for mental health resources for healthcare professionals. Please use them if you need them. The sound of alarms is the soundtrack to modern healthcare, but it doesn't have to be a source of sickness and burnout. By combining smarter technology, better hospital policies, and a greater focus on the well-being of our nursing staff, we can turn down the volume on this crisis. We can create a safer environment for patients and a healthier, more sustainable workplace for the heroes who care for them. It's time to listen, not just to the alarms, but to the nurses who are telling us the system is broken. Thank you so much for watching. If you found this information valuable, please give this video a like and subscribe to our channel for more deep dives into the critical issues facing healthcare today. And please share this video. The more people who understand the reality of alarm fatigue, the more pressure we can build for meaningful change. We'll see you in the next one.